Tonight, Prime Minister Alan Shastney tests negative for COVID-19. Police place a ban on gatherings of more than 10 people. And the Medical and Dental Association is forced to clarify its statements to physicians to limit office visits. We have the details of these stories and more coming up.
This is the Hot 7 Nightly News with Loveless and Amy Joseph.
Good night. It is Wednesday, the 18th of March 2020. Welcome to the Hot 7 TV Nightly News. We're on Flow Channel 117. The broadcast is also being simulcast on Kiss FM, on our mobile app, and our Caribbean Hot 7 TV Facebook page. I'm lovely St. Amy Joseph. Thank you for joining us. The island's Prime Minister Alan Shastney has tested negative for COVID-19. The sample was sent to the Caribbean Public Health Agency, CARPHA, on Tuesday, the 17th of March. The Prime Minister had reported experiencing a mild cough following recent travel history to Miami for medical attention. And in an abundance of caution, he opted to place himself into voluntary quarantine. We spoke to the Senior Communications Officer in the Office of the Prime Minister, Nicole MacDonald, today.
As many are aware by now, the Prime Minister was tested for COVID-19, also known as coronavirus, and the test came back negative. I just want to assure everyone that the Prime Minister is doing just fine. The tests were done obviously out of an abundance of caution. There were also some tests that were done for various persons which were in quarantine, and as you heard from the Chief Medical Officer, those tests came back as negative. So definitely there are a lot of families that are at ease today, including the family of the Prime Minister, his wife and his kids, who were concerned about his health.
Prior to receiving the results, the Ministry of Health had commenced the routine process of contact tracing some of the Prime Minister's close contacts, who also had voluntarily placed themselves into quarantine as a precaution. MacDonald says even while in quarantine, Prime Minister Alan Shastney continued to work feverishly on the island's response to COVID-19.
The Prime Minister has continued to work remotely. He has had a lot of conference calls, a lot of electronic meetings. He's been in contact with the Chief Medical Officer on a regular basis and the health team. He's also had some conference calls with CARICOM and various other agencies. The Prime Minister has been in discussions also electronically with the Cabinet of Ministers. So the work of the country continues. There's a lot that still has to be done as we chart a new way forward in terms of responding to the COVID-19 situation that we face as a country.
The Prime Minister has been informed that the results are negative. It must, of course, come as a great relief to him and many others in the nation. He is said to be in good spirits. Now, the Royal St. Lucia Police Force has outlined new stringent measures as part of the COVID-19 response. Acting Police Commissioner Milton Daisy underscored the seriousness of adhering to current bans on mass crowd gatherings and how the definition of what is a mass crowd has changed. Jacques Wooding was live in the GIS studio as Milton Daisy hosted a press conference today, Wednesday.
We are here at the studios of the Government Information Services, where members of the media have gathered to interface with representatives of the Royal St. Lucia Police Force on ongoing mitigation efforts for COVID-19. Here's what came out of that meeting.
We have noticed that a crowd has developed at a lot of the local supermarkets due to panic buying. Will we see in future police intervention maybe being present at the supermarkets to mitigate crowd development?
Yeah, actually, that should be, persons would have to take personal responsibility. We must understand that for survival, one of the essential things would be the food to get, and then we get it from the supermarket. So there would have to be a give and take situation, but persons, I think if they have gone to the supermarket and they have the means, you buy in bulk so that frequent you would not go there frequently and so on.
And in regards to assisting with the quarantines, we know that for sure a prison is no place for sick persons. What will officers be doing when persons try to escape quarantine?
Yes, when persons try to escape quarantine, actually what the law requires to do is for them to be returned to that place. So we would assist Ministry of Health, and most of those exercises, there would be representative of Ministry of Health, so we would assist them in returning these persons back to the place of quarantine.
And in interacting with these persons, have police officers received any training from the Ministry of Health in terms of seeking their own protection when interacting with suspected cases of coronavirus?
Yes, actually the officers have received training, and we continue to receive training, especially with the personal protective equipment as to how to use it, especially the body suits. We have had training with that. Also the lab is assisting us with that, because they use it during their work, and then they're assisting with it. So we are getting the assistance, we are getting the training, so that officers are now more empowered to go out there to work. At the beginning, I know it was in a panic mode. Persons did not know what to expect, but with communication, letting them know about the disease, how could it be spread, and what can be used to prevent it, and we are going okay now.
The ban on mass crowded events, including those sanctioned by the church, is effective as of Friday, the 20th of March 2020. For Hot 7 News, I am Jacko Wooding.
The St. Lucia Medical and Dental Association issued advice to its members to limit office visits amid COVID-19 concerns. The advisory was met with anxiety in some circles, prompting the president of the St. Lucia Medical and Dental Association to clarify what the association meant, saying that doctors were in no way advised to abandon their patients. Genevieve Gonzague reports.
In keeping with international guidelines and the need for social distancing, one of the key pillars of prevention in the management of the COVID-19 pandemic, the St. Lucia Medical and Dental Association strongly recommends that all members, physicians, and dentists for a period of at least 2 weeks refrain from providing care to patients within their office spaces and instead utilize the various forms of telecommunication which are widely available for urgent consultation. This course of action is being taken primarily to protect our patients and by extension our community, and to ensure that urgent healthcare needs are addressed, while these seemingly extreme but absolutely necessary measures are implemented. This was the statement by the St. Lucia Medical and Dental Association to its members. The statement incited panic and concern in some quarters and has prompted the president of the St. Lucia Medical and Dental Association, Merle Clark, to verify.
So last evening, after a committee meeting, we at the St. Lucia Medical and Dental Association sent out a press release with the recommendations for our physicians, and dentists as well. And the recommendation essentially was that we practice more telemedicine. Now, why was there a need for that? What is the rationale for the recommendation? Because it certainly seems to have caused quite a bit of consternation, quite a bit of confusion. Doctors' offices have been inundated with calls. So Lucia, let me say right here, right now, that this is not cause for panic. We are never going to abandon you. We are all in this fight against COVID-19 together. The reason we opted to tell our physicians we should try to limit the number of consultations done within a physical structure, a physical space of an office, and to move perhaps more towards telemedicine is to limit the number of patients coming into the office in keeping with the social distancing that we keep hearing about a lot. So what are the pillars in this fight against COVID-19? We need to ensure that we don't have people milling about all the time, because if we have community transmission, then one person can be spreading it to the other.
Clark explained that this move is to serve in the best interest of those most susceptible to the virus.
We just want, essentially, out of an abundance of caution, to try to prevent, particularly the patients who are most susceptible, our diabetics, our hypertensive, the patients with COPD, patients with chronic kidney disease, our elderly patients. We want to keep them for now at home.
She clarified what the recommendation telemedicine was and how it would operate.
So essentially, when you call a doctor and say, "Doc, my labs," that sort of thing, and it can be explained to you over the phone, that does not mean that doctors' offices are all just going to simultaneously close and you're not going to be able to see a doctor. Far from it. What we are recommending is you keep your normal appointments. So if you are Dr. Clark's patient, for example, you call for your appointment, or if you had an appointment, you will be contacted, and the doctor will guide you as to what to do. So if a patient we believe can be seen via, not WhatsApp, because WhatsApp is fairly secure, but there are special apps that we physicians use, and we've been sharing with each other which apps are most secure in terms of doing this for our patients.
Clark says these measures put in place by the association is to ensure both the safety of its members and the public.
The space, and remember, we are trying to protect our general public. If we don't curb this, it's going to overwhelm our already fragile healthcare system, and that is what we're trying to avoid. Moreover, we physicians, particularly in the private sector, what we want is to be able to be available if the call were to come. We have a pending move to the Owen King Area Hospital. Everybody has to be on board for that. If one physician, God forbid, were to become ill, somebody has to replace them. So these are the strategies that we are putting in place to ensure that we protect you, the public. Because if every doctor gets sick at the same time, if every doctor is exposed or has to be quarantined, then we have a problem. Because right now we can't count on our friendly nations as much. Cuba is going to help, and Taiwan is going to help. But everybody does have their own issues because this is a pandemic, and we have to be aware of that we have to be able to help ourselves.
The St. Lucia Medical and Dental Association fully support the decisions by the police to curb social activities, as they believe now is the time to come together to ensure that the virus is contained and fight COVID-19. Reporting for Hot 7 News, I am Genevieve Gonzague.
Massy Stores is urging consumers to buy what they need to ease the pressure on the supply chain. The managing director says hoarding excess quantities of goods has a detrimental impact on everyone. In the event that consumers do not do the responsible thing on their own, the supermarket chain is looking at introducing limits on the purchase of some items.
Panic buying and hoarding are putting even more pressure on the supermarket supply chains. However, Managing Director of Massy Stores, Martin Dorville, says the supermarket chain is managing its supply well at this point, and there are no alarming food shortages. Some brands of cleaning supplies, however, are in short supply. Dorville says moving forward, there are going to be considerations about putting limits on the sale of some items.
We are going to be looking at some items that we potentially will have to place some rationing, some limits on per transaction. And we ask that solutions bear with us, because in cases where this has been done in the supermarket, customers can get pretty abusive when they get emotional about it, because you understand that you're trying to safeguard your family, you're trying to safeguard your life in a way, so it appears, but we want to make sure that there is no unnecessary interruption to the supply chain. So we may have to set limits on what we buy, and we are working on that as we speak.
Dorville says people should be conscientious shoppers and also think of others.
If we do not hoard, I am confident there could be enough for everybody. And I wish we could be in a position where we say, if you have 10 bales of toilet paper at home, bring some back, please, because you know you're not going to need that much for yourself. And it's important that we do not lose our sense of humanity in a case like this, where you would have 10 hand sanitizers and your neighbor or your brother or your sister has none. Because, as I've said previously, it gives you a false sense of protection. It is better that each of us have one, or each of us have two, rather than you having all and somebody else having none.
The supermarket chain says in the event that they do impose limitations on the purchase of some items, they will be improving security, given the tendency of shoppers to get aggressive once it is communicated that they are not allowed to purchase what they want in the quantities that they want it. He urges all to be considerate as the country tries to ride out this COVID-19 pandemic.
This is the Hot 7 TV Nightly News. Still to come, the elderly are the most vulnerable during the COVID-19 pandemic. We see how the elderly homes are preparing for the virus. The taxi union president says more should have been done to cushion the impact of COVID-19 on the tourism sector. And is prayer the answer to COVID-19? We have the details coming up after the break.